welcome to a Senior Citizens Forum. I'm your host, Janice Wood, and at a Senior Citizens Forum, we provide information for seniors and their families. And the reason why we say families, because the information that we provide, we definitely believe can also help families and also help families help seniors out. Today, my guest is Ken Rasmus, and we are going to be talking about the differences between Medicare insurance if you go privately, uh, comparing it to your employer plan, retirement plan, if they offer Medicare insurance for you, or a union plan, because I have clients that have both, that I've taken over both as uh, come privately to me because of the plans not being as rich as a Medicare plan. And Ken is an expert at this. Ken is part of a group called Applied General Agency, which my benefits for you too, insurance services is part of. They work with carriers to help independent agents. And not only do they do Medicare, they also do the different types of life insurances that are available to them. So they're becoming more encompassing in what they do for seniors and their families. Um, One of the things I have just realized that since 2023, there's been an increase of 19% of seniors that are still working, and they may be receiving their health benefits from their employers. So if they're over the age of 65 or with certain disabilities and still working, they may want to still look at an independent Medicare Advantage plan. And we're going to try to describe what the differences are and what you should be looking for. Ken represents a group of independent agents that are in all 50 states. I don't know if they're in the different territories, but I know they're in the different states. So Ken has been doing in the Medicare world for since 1992. He helps promote agents. He works with insurance carriers that work with the agents. He also helps provide education to agents. And he also does business development, which helps people like me grow my business. So Ken, welcome to a Senior Citizens Forum. Uh, we have a real important topic to talk about this morning. So let's get started.
Yeah, thank you, Janice, for having me on. I really appreciate it. You're a great asset to our organization, and we certainly love having folks like yourself as part of our team. So thank you very much for having me on.
Yes, well, this has been exciting to add to what I do with the Medicare, this particular show, because I know I've just have learned so much from working with seniors and what they need. So,
Yeah,
so when we're looking at an employer plan versus what we provide. Well, first of all, I want to say we don't work for Social Security and we don't work for Medicare itself, the Center for Medicare and Medicaid Services. We represent private insurance companies.
correct.
So
Yeah,
that is very important to know that this is where we stand. So, but when over the years, I have worked with people that uh, they're always shocked at what we have to offer versus what their employers have to offer. Now, I'm a person that has retired from a municipality, and my particular municipality offers a really good health insurance plan, Medicare plans for me. So I don't really need, I'm not my own client, but I can sit there and I compare everything every single solitary year to what they offer to what I know I'm offering because I represent through Ken many different carriers.
Yeah, correct. And we're finding also that being that Medicare ages for full Social Security benefits at this point is age 67, we're finding that many people are working beyond Medicare age, which is typically 65. And I'm called on every month by various different employers to try to answer those questions for their employees regarding Medicare, but also to your point, their family members also really benefit from this information because a lot of them are wondering, is there something better for mom or dad or for my aunt or uncle or something like that? So that's basically what the topic today basically takes a look at, just in general, what Medicare is, and then why should someone consider Medicare as an option to their employer plan, and then also what are those choices that are available to them? Because you mentioned, we hear people talk about alphabet soup, part A, part B, part C, part D. This is all becoming more complicated over time. When I first got into this business in 1992, it seemed fairly simple, but it just seems to be more complex over time. And our services become more valuable to the individual because of those complexities.
I mean, and it's very complex because over the years and working with seniors, they'll say, this is just so overwhelming what I have to choose. And then the medical industry not only is changing, especially since the pandemic. I've seen so many more changes, and it's just
Correct.
and it gets very confusing when you're in the middle of the calendar year, which I had happen to me. All of a sudden, my medical group didn't have a contract with the carrier,
Right.
which
Yeah.
gets
When
very.
you look at when you look at the reasons why individuals may make that decision, provider um, access is certainly one of them. They may also find that by looking at a Medicare plan, they may have some reduced out of pocket costs, or they may have some enhanced pharmaceutical benefits. But to your point, that provider component, hospitals and physicians, that's kind of a moving target because they're through contracts. And if you're looking at the type of a program like a PPO or an HMO program, that really impacts the access to those providers if those contracts conclude or if they terminate. But then there's also additional contracts that are always coming on. So that's something to certainly consider when looking at a Medicare option. Is my preferred hospital and is my preferred physicians available to this certain type of a program?
I mean, I think that's the most important part of what I do, especially when I compare. It doesn't matter what plan I'm comparing, but even when I'm comparing employer plans or union plans to our plans, one of the most important things I make sure is that their medical group or their doctors are contracted with those plans.
Correct.
And
Yeah, and
it,
also there's also a misconception that when someone has Medicare, that it actually covers everything. So we know that there's on employer plans or on retirement plans, you may find deductibles and co-insurances. Deductibles and co-insurances also exist with Medicare itself as well. Some of those deductibles are not annual deductible. So the Part A deductible, for example, is not an annual deductible. So someone could pay that deductible multiple times in the worst case scenario throughout a calendar year. So all things to consider, but all in all, a Medicare option may be a great choice because there's also products made available if someone decides to go that direction in the way of Medicare Advantage plans, for example, or Medicare supplements that actually reduce or eliminate, in most cases, those deductibles and co-insurances that exist throughout Medicare.
right. And one of the things, I have a great example. I have a clients that I picked up over the last annual election period, as we referred to as AEP. And when I went over to talk with them, I their daughter had recommended me to them, and to find out that they were paying for their Part B premium, which is the Part B premium is which is the medical, your outpatient hospital, and your lab test. And not only were they paying that $185 premium that we have for this calendar year, they were also paying another premium on top of that, was close to $170 a month. That was per person. That's a lot of money because a lot of our Medicare Advantage plans are zero or have minimal premiums that go with it. So it depends upon your area and where you live, because it can be different from state to state, and within a state it can be different from county to county. Okay,
Correct.
so when I look at all that, it becomes overwhelming. So they were very shocked. So after I sat down and did the presentation with them, they said, this is a no-brainer, we want to go with you. But one of the things that I did do before I actually signed them up, I said, I want to make sure that this doesn't affect any of your other retirement benefits if you leave. And also, if for some reason you need to go back to your employer benefits, I want to make sure that you can go back.
Yeah, those are very important questions when someone currently has, they've already retired and they currently have a retirement plan. I always recommend, same advice that you had, uh, go to your employer or your HR department, ask exactly what is covered in my retirement benefits. And if for some reason I choose to go with a Medicare option, but I choose at some point to come back to my employer plan, is that something that's possible? And if I don't come back, what are those things that I'm losing? Because of those things you'll never get back if you can't go back and get them back. You're just never going to get them back after working all those years for that employer. So that's a very, very important question, Janice.
And I just think I even have some of them say, show me where I can go back, because I don't want to personally be responsible for them to lose some important benefits that's other than their Medicare benefits.
Yeah, if you can get things in writing from your employer, have them send you an email, have them confirm for you in some type of a written format that if you leave our retirement coverage, that you can come back at whatever point based on whatever those written documents would say to you. But I would say, uh, if at all possible, certainly get something in writing from your employer stating that you can come back if you
Right.
choose to do so.
Okay. Now, one of the things that's really interesting, and Ken was talking about it before, we pay for the Part B, which I said is your medical, okay, and your outpatient hospital. But your Part A is your inpatient hospital. It's your skilled nursing, and hospice comes underneath that. If you paid in to your through your FICA taxes or your SECA taxes, then there's no premium to Part A. But I've run across and I've been able to recognize it because I was affected. When I worked for that municipality, I never paid into Social Security those FICA taxes, and my benefits then were completely different than what they weren't
Yeah,
as they weren't as I want to say rich. They didn't provide as much for me because I'm now an independent agent. Uh, when I go to pay my SECA taxes, which is the same as FICA taxes, I now have those years in, and my benefits have changed. But I've run across other people where it's like their Part A was being paid for by their employer because it did not pay for Social Security.
yeah. So in general, most people would pay generally 40 quarters into FICA tax, which would make your Part A available to you. If
Right.
someone maybe has a county job, state job, sometimes school district, sometimes those type
Yeah.
of jobs will not necessarily pay into the FICA tax system. So if we're just looking at 2025 numbers, if someone was not paying into that system and they needed to purchase Part A, if they work less than 30 quarters, and paid into FICA tax for less than 30 quarters,
Yeah.
they would actually pay $518 a
Yeah.
month for Part A of Medicare.
Yeah.
If they work between 30 and 39 quarters, it's reduced to 285 monthly in 2025. But that's still it's a tremendous amount for someone to have to, that's a burden for someone to have to bear just to have Part A of Medicare, due to the fact again that they just hadn't paid into that FICA tax system for those 40
Yeah.
qualifying quarters.
And I actually have a client that does that.
Yeah.
Yeah.
Sometimes it makes sense. Health insurance is expensive. So even though that seems like a lot, in many cases it just makes sense that you
Hmm.
go ahead and pay it, and overall it's the right thing to do.
Yeah. It is, and making this decision is not always easy, and this is very confusing. So that's why I think, and talking with Ken before this, we know that this is very confusing. We know that it's very important decision to make if you're going to stay with your employer or you're going to go to independent agent or just keep Medicare itself, which opens up, and I know Ken likes to talk about this, what Medicare doesn't cover.
Mhm. Right. Yeah. So when Janice was mentioning the Part B premium, for everyone who has Medicare, typically, I hate to group everybody together because there's always exceptions, but typically individuals in 2025 would pay $185 a month for Part B of Medicare. Now, again, depending on what your income level was while you were working, there's also something called a income related monthly adjustment amount, which could have someone pay more than that if they made more than $106,000 a year or filed jointly at $212,000 a year. They could actually pay more than that. And that additional amount is added to that 185, resulting in a higher monthly premium for Part B. Now, again, they only look back 24 months. So when they look back 24 months, they may say that once someone falls below that threshold of making those income levels, that they would revert back to the standard monthly premium. But that's again one of the complexities of the Medicare system. For Janice and I, we live this every day. So we understand all of those rules and regulations. But for the general population, they may not understand all of the complexities in the rules and regulations of Medicare or actually how it functions. So, although someone may pay more like $185 a month for a Part B premium, all in all, when they do that and then maybe get involved in a Medicare Advantage plan, for example, Janice pointed out absolutely correctly, they all differ from state to state, county to county, zip code to zip code. I do presentations monthly that are national presentations for employers, for individuals who are still working beyond age 65. Medicare or Social Security at this time, full Social Security is not available until age 67 at this point. So when looking at that, even though Medicare may have some costs associated, it still may be much, much more affordable than the employer plan that someone is currently on while currently employed.
And one of the things that when you have an employer plan and you're leaving it, you want to make sure that though that coverage is what they consider credible coverage, especially which we haven't even gotten into is the Part D, which is the prescription drug plan. So if you're making those higher income levels where you're getting where you're over the where you're paying more than I'm not it's not coming out right, you can also be
Pay more
paying
than the
more
standard amount, correct?
yeah, it's a higher amount that you pay for that premium.
Right.
And you
Yeah. So
also
there are this. Go ahead, Janice.
yeah, you also want to make sure that Medicare recognizes the plan that you're on, because if you don't have credible insurance, and it's really shocking when I meet with people and find out that they don't have Part D insurance, they're getting a penalty which doesn't go away.
Right. Yeah, and that's something that I mentioned the complexities and the rules and regulations. There's a when we talk with an individual and assist them with some type of a Medicare product, we have to make sure that we get things timed correctly, especially currently if they're still employed, for example. We would need to make sure we time things correctly in order to avoid two different types of penalty. One is the Part B penalty. So if someone does not enroll when they're supposed to enroll or when they should enroll, and typically that's age 65 for most people, but if you still have your employer coverage and you have, to Janice's point, credible coverage through your employer for prescription drugs, you can avoid those Part B and Part D penalties while you're still employed. But once you decide to retire, then there's a window of time in which you'll need to make a decision to avoid those penalties moving forward. So that's again where our agents, folks like Janice and the rest of our team, would assist in helping you orchestrate everything to avoid those penalties. The good news is, if you are employed and you do have credible coverage and haven't enrolled in Medicare when you were just turning 65, so you do have credible coverage with no penalties in place, the good news is you can actually retire at any point in time. You can wake up some morning in April and say you want to retire in June, for example, and you can do that. And I would say probably 90 days to 120 days, three months to 4 months before retiring, that you would want to reach out to someone like Janice and start having that conversation and saying, I'm getting ready to retire. I'm contemplating what I should do at this point when I do retire, and then they can help you orchestrate all of that uh, so you can avoid those penalties. Now, conversely, even though you're not retiring, you still may want to consider a Medicare option while you're still employed, because once again, it just may be a much more affordable option for you. You may have less, lower coinsurance, lower deductibles, maybe some additional provider groups or hospitals made available, or variety of different things that may be important to you. That again, those discussions can be had with Janice or with one of our agents.
Yeah. And also, if you're still working and you decide to keep your employer plan, you should be picking up at least Medicare Part A option, because it has no premium to it and act as a secondary in paying any of those hospital skilled nursing facility
Correct.
benefits.
And another thing to consider also is that there's, again, you're going to hear me say it in many cases, rules and regulations. There are different rules and regulations related to Medicare depending on the size of your employer. So if you have a smaller employer with maybe 50 employees or less, you would actually be required to have your Medicare in place, because your Medicare would be primary in a small employer, and your health insurance would become secondary, versus a larger employer with, again, hundreds or thousands of employees, where you would not be required to have Medicare while still employed, because again, you would have your group insurance and it's just not a requirement based on the rules and regulations of Medicare. But if you have an employer or you're working for an employer that's a smaller employer, once again, if you're 65 years or older, you may want to check with your HR department just to make sure, should you have your Medicare in place. And I would suggest doing that, once again, 3 to 4 months before turning 65, to have that conversation with your HR department.
Yeah. And the other thing that you should be looking for if you're still working is how long your employer will cover you. Because I've had instances where the employer will only cover them, say, until they're 67, and then they have to go out on their own. So you should know what is part of your retirement package.
Yeah, I think so. In conversations again with your HR department, whether you're still employed there or it's a former employer, I would say make sure you know how to reach them and feel comfortable having those conversations with them. So that way you'll know from their perspective what can be done. And then also, again, and this is the unfortunate side of it, still talking to somebody like Janice or an agent who really works in the Medicare space, because again, this is the unfortunate part. Sometimes you may receive bad advice or you may receive bad information from your HR department. And this is even further shocking. And don't laugh when I say this, Janice, or anyone else, but you may find that you receive bad information even when contacting Social Security. I can't tell you how many times I've worked with individuals,
Oh,
had a question, contacted Social Security, and received the absolute wrong answer. So
and
having an agent, right?
yeah, I
Yeah,
have personally have experienced that with Social Security, and I am an agent, and I can't tell you how stressful it is.
right. Yeah, and
It's
it's so unfortunate. We,
extremely
we pay our
stressful.
tax dollars, right? We pay our tax dollars, and we want to believe that those in the government agencies are going to provide us with true and accurate information, and we have to be very careful because again, I think it's even complicated for them. This isn't really what they do necessarily. They just have their questions and answers and things that they're told, things that they remember. I can't imagine being on the phone all day answering questions, but that is a fact that you quite possibly could receive wrong information actually from Social Security. So having an agent that's well versed, somebody like Janice or someone in your state or your local area. And again, to Janice's point, we have agents all throughout the entire country, all 50 states, all counties. We have folks available to help answer questions for you. So I would encourage you to make sure that you have close contact with an agent, just as you're working through the investigation process, trying to determine what you may want to do, and then hopefully you'll get some guidance from that agent as well.
Well, one of the things going back to Social Security, they cannot give you any advice. And if you have something like I had that was unusual, because it's not every day that you come across somebody that does not have Part A.
Right.
And it was like, I don't know how many people I talked to until we figured out what was going on. Like they wanted to charge me for Part A because I didn't have it, and I would say I'm not paying for Part A, and it was a nightmare. That's all I could say. And then when I finally able to get Part A, they kept telling me I didn't have enough quarters, and my CPA kept saying I did. So with like it was insane. So
Yeah.
even though I know what I'm doing, when I remember getting off the phone and going, "This is unbelievable," and I know Social Security made a mistake because of how they backdated everything.
Yeah,
So
and yeah, keeping records, having information made available based on past employment and all those types of important items, very important because once again, you could get denied coverage, wrongly denied coverage based on information that Social Security may have, whether it be correct or incorrect.
yeah,
So also when you look at again, I'm going to say retired or still working, when you look at the different types of plans that are available, once you've decided you want to get your Medicare, you work through all those details, now you have your Medicare, and you're considering what type of plans you should consider. I'd like to talk about two different paths that are the most common that individuals would consider when looking at a Medicare product. So, one is maybe having original Medicare. We talked about Part A in most cases being at no cost once you paid into the FICA tax. Also, Part B being 185 monthly for those in 2025. And then also if you have Part A and B of Medicare, you're also required to, in order to avoid the penalty, you're required to have a Part D prescription drug plan. So that's again an additional cost for the individual who has Medicare, original Medicare. So what you want to try to do is again, I mentioned that you have in original Medicare co-payments, deductibles, everything's not taken care of. You also have the Part D premiums. You may want to try to avoid some of those costs that can be avoided. One of the ways that an individual may do that is by purchasing a Medicare supplement that takes care of the 20%, because Medicare is an 80-20 plan. Medicare pays 80%, the individual pays 20%. So a Medicare supplement would basically pick up the 20% that the individual would be responsible for if they had a Medicare approved or Medicare recognized service. That would be covered by the Medicare supplement. The other option is a Medicare Advantage plan. Medicare Advantage plans in many states may not have a premium. So someone may pay the 185 for the Part B, but they may not pay anything additional to that for the plan itself. Now, I will give you a disclaimer and tell you that that does vary from state to state, county to county, and product type to product type. Where again, an HMO plan in a certain area may not have a premium, but a PPO plan in the same area may have a premium. But they're also both considered Medicare Advantage plans. Now, one step further is within the Medicare Advantage plans, in many cases, the Part D prescription drug benefit would also be embedded in the plan at no additional cost. So with a Medicare Advantage plan, you may only really have to pay the 185. And again, keep in mind there may be some additional cost depending on where you live. But one of the other items to know about a Medicare Advantage plan is, once again, these plans would have provider networks. So you would have specific hospitals, specific physicians or medical groups that you would utilize in the HMO version. And then in the PPO version, you may have some specific hospitals and medical groups that are preferred providers, PPO, preferred provider organization. But you also may have the ability to go outside of that network and use other physicians that are not preferred providers, but usually that would be at an additional cost. So again, I know I just said a lot in the last few minutes there, and again, I do understand it can be very confusing, but that's the landscape, and that's kind of what you would encounter when you're doing your investigation. And again, I'll say rely on a highly qualified agent like Janice or someone like Janice in your area to help with those decisions.
Well, real quick before we go into something else, Medicare, original Medicare itself, that's A and B, okay, which does not include prescription drugs, all right? It doesn't cover everything. It doesn't cover things like hearing aids. It doesn't cover things like glasses. And you think that that would be covered because seniors need hearing aids and we all need glasses at some point in our life, okay? Uh, there's a lot of other things it doesn't cover. It doesn't cover all medications, where some of these Medicare Advantage plans and supplemental plans do cover that. Also, it doesn't cover dental. And a lot of these Medicare Advantage plans and even supplemental plans will have some extra types of benefits in them. And as Ken knows, those benefits can be from groceries, they can be from somebody taking care of your dog while you're in the hospital. It just depends upon the carrier and what they do. So, and also, Medicare, original Medicare does not cover you outside of the United States, which is real important because I have run across people who did not know that and were traveling outside the United States. I had someone that as a client who went to Canada, and Medicare wasn't recognized as a credible health insurance for Canada. She had a stroke, and if you have a stroke, you want to get a shot within the first six hours. That did not happen for her. She came back, she was paralyzed, and she had to go through years of rehabilitation. And it was very costly. I have a client that had a Medicare Advantage plan traveling in France, had a stroke, everything was covered. So that is an important question. If you're traveling, what does your medical insurance cover?
Yeah, that's a very good point. And looking at the two different types of products, as I mentioned earlier, with the Medicare supplement, Medicare supplements are only going to cover things that are approved services that are approved by Medicare. Medicare Advantage plans must cover all services approved by Medicare, but they can cover many additional services, just like Janice pointed out with vision, dental, transportation in some cases, foreign travel, a lot of items that are covered under a Medicare Advantage plan that you may not find in a Medicare supplement. And one other point that I want to make with comparing the two different types of plans, just for clarity, is Medicare supplements are truly designed to help you pay your bills. That's what they're designed for. They're not by design a plan that is there to improve your health. I know that that may sound unfair to a physician. I'm sure the physicians and the hospitals are doing all that they can to keep you in the best health possible. But by design, the Medicare supplement plans themselves have no components within them that are designed to do anything other than help you pay your bills. Conversely, Medicare Advantage plans do what they call Medicare Advantage plan techniques or managed care techniques. Those plans have certain items within them that are triggered based on conditions and what the patient needs that try to do things in order to try to catch a condition in its early stages or to identify something prior to it becoming a catastrophic condition. So they are designed to try to keep you in your optimal health through managed care techniques. Give you one example. And this was a managed care product that works in relation to a medical group. So we all know that when people get older, they may fall. One of the byproducts of that fall could be a broken hip. One of the byproducts of that broken hip is pneumonia. Sometimes that doesn't end well, and sometimes the patient doesn't survive that. So, one of the managed care techniques that you may find throughout some of these Medicare Advantage plans and through some of the medical groups is those medical groups may contact the individual somewhere around maybe age 72, talk to them about their mobility, talk to them about canes and walkers and wheelchairs in hopes that they can make sure that the individual safely gets around, prevents falling, which is going to prevent the broken hip, which is going to prevent the pneumonia, which keeps that individual in the optimal health. So that's a very basic example of the differences between a Medicare Advantage plan and a Medicare supplement. Medicare supplement designed to pay your bills. Medicare Advantage plans truly designed to try to keep you in your optimal health by making sure that they're doing all of the things ahead of time to prevent conditions somewhere down the road.
Well, one of the things that's real important with the Medicare Advantage plans and prescription drug plans to do exactly that, they are rated every year by by CMS, that's the Center for Medicaid and Medicare Services, and they have what they call a star rating system. And they're you want to have a 5 star, that's what you want your goal to be. I know when I go out and I show plans, I like to do 4 stars and above. Somebody wants something that's less than that, I will always tell them. And the agent, any agent you deal with, should be telling you what those star ratings are. And that is just like what Ken was explaining, is to keep you healthy.
All of these plans, to Janice's point, are monitored by Medicare,
Yeah.
and there's everything from customer service scores to the patient's health and specific to various different conditions, heart disease, diabetes, kidney dialysis. They take a look at all of these various things that can happen within these plans, and they give them a star rating. To Janice's point, being with a plan that's 4 stars, 5 stars, very hard to achieve 5 stars in a plan, but 4 stars, great place to be. If you're considering a plan that's maybe a 2.5 star plan or a 3 star plan, you may want to reconsider that because, again, there's reasons why they're rated so low. You may have your doctor that you want. Benefits may look great, but if they're not delivering care in a manner that's getting them to to achieve a higher star rating, you may want to stay away from those lower star rated plans. And in fact, also medical groups also have star ratings as well. So just more
Yeah.
things to right, more things to discover, more things to uncover, more things to have conversations about. Because again, the agents will know these things. You may not know as a consumer. The consumer may not know.
Right.
Um, either even how to find that information on medical groups or what that information truly means relate in relation to a medical group or a health plan. That's a very good call
Yeah,
out, Janice.
and also if you're looking at your employer plans, you want to see what their ratings are on those particular plans because with most of the employers are going to have the same carriers that we are providing you, and those all those ratings are for across the board, even if they are employer plans. So you want to ask what the star ratings are because it's going to affect your health if you're not in a high star rated plan that's working with a medical group.
Yeah, that's a very very good point. And again, having your benefits on paper looks great, but getting what you need when you need it, that's really what you find that affects the star ratings. So if somebody needs a particular type of care or a particular type of service, are they really getting those things that are listed on the paper? Again, very nice to see all these great benefits on paper, but are you getting what you need when you need it? So that's really imperative, and that's really what the star ratings are all about.
Yeah. And one of the other things is that I know what I like to do as an agent is that I like to check in with my clients during the year. Okay. I also tell my clients if they don't remember something and when they see that all that information that comes from the carriers comes to them, that if they don't understand it, please call me so I can explain it to you or refresh your memory on what you need to do. And I found this particular calendar year, I've had a lot of phone calls where people have been a little bit more not understanding what's going on.
Yeah, and I think it's important to have that type of a relationship with the individual that you're working with as an agent. Are there a lot of good agents out there? There really are. There's really a tremendous amount of individuals where their heart is in the right place. They know their business, they know their markets, and they can really give you really outstanding advice. Those individuals should be available to you not only when they help you enroll, but they should be available to you to answer questions or provide any customer service or just be there, by your side or with you in some manner. Whenever you have something that you're concerned with, you should feel free to call on them and say, I woke up last night and was worried about this. What are your thoughts on that? And
Yeah.
be able to ask those questions and get the answers that you deserve. So that relationship is extremely important.
And I found that this year I've had to work with the with my client, and then I've had to go back to the carrier to get some things straightened out.
Right, and there again, that's the advantage of having someone like Janice or an agent that you're working with is it prevents the individual policyholder or the person who's insured from having to figure out who do I call. So if someone says I didn't get this, whatever that this might be, is that something the medical group should have taken care of? Is that something that the health plan should have been taken care of? So that would allow the agent to go into action and begin having those conversations on the individual's behalf and trying to elicit those answers that are going to be, again, so helpful to that individual. We know our way around the health plans. So if there's something that you need, I would say contacting your agent would be the right approach. In certainly you can call your health plan and have them help you. I would never suggest that that's not a good idea as well. but calling your agent is another option for you. And I just want to clarify also, as Janice puts my information up on the screen, this is information that is my personal information as the Director of Carrier Operations at Applied General Agency. I've been here for a number of years, as Janice mentioned. I've been around since 1992 in this business. I would personally not be the one helping you to make those decisions or have those conversations. But what I would do is get you in touch with a local agent in your market, and they would be able to assist you in those questions and that further assistance based on where you live, where you reside, and what might be important to you. Appreciate you putting my information up there, Janice.
Well, thank you. Well, I know I have in the past, I've had clients that have moved, or I'll have somebody call me and say, do you know somebody in such and such an area that I cannot represent? And I will call Ken up, and I'm always am referred to uh, an agent that I can work with in another state. If you live in the state of California, where I happen to be at, I can definitely help you. But if you're going to move to another state, I do not have licenses anymore in other states. I contact Ken, and he gets a qualified agent for me to refer my clients to. And I even sometimes will work with them if it's an existing client, to make sure that they're taken care of before I call it passing the baton over to them. Okay. So that's just really important. So if you're choosing an agent, I would definitely say you want one that's going to stay in touch with you.
And also, too, something that's important is that all of the services that we provide or that Janice provides, they're provided to you at no cost. So it doesn't cost you anything to call Janice and ask your Medicare questions. It doesn't cost you anything to contact an agent and ask your Medicare questions. And sometimes we're tested when we say that we're in all 50 states. People say, well, wait a second, you actually have agents in Alaska? We do. We have agents in Alaska. We have agents in Hawaii. We do. So, that relationship is very, very important. And just once again, I just really wanted to really emphasize the support or assistance of an agent should always be at no cost to you.
That is very important, because I'm asked that all the time by people. Well, do you charge for your services? And how do you get paid? And I'm upfront with them. I get paid from the carrier.
Correct.
Yeah.
Yeah, and that's one of the things that Medicare has certain disclaimers that all agents need to say when they're meeting with someone. Janice this morning or today mentioning the that we're not part of Medicare, where we don't work for insurance companies, where we don't work for Medicare. Also, that other portion of how are we paid. Another disclaimer that we are required to divulge is that we are paid by the carriers. No expenses to you in having conversations with us at all.
Yeah. So I think it's real important, because I know when I go out there, I will meet people and they'll say, I have I signed up with an agent and I never heard from them again. I hear that constantly. So
Yeah, that's very important, and then that's why I say that relationship between you and your agent is so imperative, and it should be an enduring relationship. It shouldn't be where someone speaks with you, enrolls you on a product, and then they never hear from you again. I enrolled. I always say 3,500 people, but I enrolled 3,498. If I would have worked one more day, I probably would have reached 3,500. But so many of my enrollments would come to me because I would ask that question. I would go through everything that I went through with them, but then I would ask them, so let me ask you, the individual who enrolled you on your current health plan, how often do you speak with them? And they would tell me that they've never heard from them since they enrolled them. And I would tell them that's not how I do business. So I kept in touch with all of my clients every 90 days in some manner. I would call them and ask how were their flowers blooming yet, or are they having people over for the holidays, or whatever the case may be. But I would keep in touch with them about every 90 days. I would be dialing the phone and speaking with them. I don't want to be a burden, but I do want to be a good friend and I do want to be available. But so many of the individuals that I enrolled, I really couldn't offer them much more than really being a good agent for them. So that was enough for them, and they would enroll.
Yeah. And I have people call me up and just to talk to me. And then,
Sure.
and for me, I always feel embarrassed every time it happens is when I have people give me a present.
Mm,
They feel like, well, we're not paying you, but we want to give you a present because I will never take anything monetary. And it makes me feel I'm uncomfortable with it, but it's an honor at the same time.
mm. Right. Yeah. Once in a while, somebody may send you a box of chocolates or something, right?
Well, I get chocolates, I get all kinds of things.
Yeah.
But then you have to be gracious too, because you don't want to embarrass them by saying no, you can't, because it's a fine line that as an agent that I have to stay at. But I also don't want to make them feel uncomfortable at the same time because they're coming from a good place.
Yeah. And typically, what we receive is of not great value. It's usually just a token of thanks or something
It is
like
just
that.
a
So,
token, yeah, that they
yeah,
appreciate that you care. I
sure.
mean, I mean, so you want to find an agent that's going to care about you.
Yeah. There's an old saying that said nobody cares how much you know until they know how much you care. Right.
Right.
So that's an important statement.
I mean, I had somebody the other day call me up and say, can you help me choose this plan?" And I'm going, and it was through something that I could not help her with. I only trust you. And I go, that's what's a lot on me, but it's also very complimentary.
Yeah. Yeah. It's been a true pleasure being on your show, Janice, and I certainly appreciate you
Yeah,
having me on. And it's just this conversation is such an important conversation, and many again just don't know how to get to the resources that are going to help them make
yeah.
those decisions that are the right decisions at that point in time.
So,
So certainly
so
appreciate you having me on.
please feel free to contact Ken. He's available if you want to contact me. I had my that information up earlier in the show. And thank you so much for watching us. We always provide a lot of information. I'm hoping to have Ken back to talk about some different subjects again that pertain to Medicare or health. So thank you, Ken, and please join me again. I would love to have you back on a Senior Citizens Forum. Thank you.
Lovely.